seminars, New Approaches to Migration Theory and Research, organized by the Center of Migration Research at the University of Warsaw. So before I introduce our guest speakers, a few technicalities. The webinar will last up to 1.5 hours, and the presentation will be followed by a discussion and Q&A session. So during the presentation, you can write down your questions and comments in the chat, and I can read them out loud after the presentation. Or if you would like to speak in person, then ask the question in person, then please place a plus in the chat so I know who to ask to speak. Let me now introduce our guest speakers. It is my great pleasure to introduce Karolina Follis, who is a senior lecturer in the Department of Politics, Philosophy and Religion at Lancaster University, UK. And she has written on border regimes, surveillance technologies, and ideas and practices of human rights. And she's very well known actually among our CMR team members, thanks to her book also, Building Fortress Europe, the Polish-Ukrainian Frontier. And she's currently developing work on healthcare for migrants and refugees as the principal investigator of Doctors Within Borders, a project funded by the Wellcome Trust. And I'm also very happy to introduce to you Roxana Barbulescu, who is Associate Professor in the School of Sociology and Social Policy at the University of Leeds in the UK. And her area of expertise focuses on migrant communities and practices of migration and mobility, particularly in connection with migrants and refugees' rights, citizenship, intra-EU mobility, and migration control. And she's the author of a monograph, Migrant Integration in a Changing Europe, Immigrants, European Citizens, and Co-ethnics in Italy and Spain, and the co-author of Everyday Europe, Social Transnationalism in an Unsettled Continent. And she's currently working on two Economic and Social Research Council-funded projects, Feeding the Nation, Seasonal Migrant Workers and Food Security during COVID-19 pandemic, and Northern Exposure, Race, Nation, and Disaffection in ordinary towns and cities after Brexit. And I'm delighted that you have accepted our invitation, and I'm looking forward to hear your presentation. And we'll start with Karolina Follis.
Hi, thank you. I am so delighted to be with you guys today. Thank you for inviting me. And let me just see, I think I'll just go straight into, we've rehearsed this, straight into sharing my screen. Okay, so I hope you're seeing my slides now. Can you see a title slide? Yeah?
Yes.
Okay, perfect. So yeah, let's go with that. So what I want to do today is I want to use the time you've given me to tell you about some conceptual work I've been doing to try and understand the pandemic through the lens of multiple mobilities. So this is going to be loosely based on a chapter. Let me see, I want to advance the slide and it's not going. Oh, here we go. So it's going to be loosely based on a chapter that my colleagues and I contributed to Deborah Lepton's and Karen Willis's book, The COVID-19 Crisis, Social Perspectives, which was actually just published by Routledge. And to give you some context, Marta kindly mentioned my project. So this work arises out of this project that I currently lead with my lovely collaborators who are on the slide. And this project is called Doctors Within Borders. And it is, as Marta said, concerned with the provision of healthcare to migrants, refugees, and other people who are on the move. And we had started this project in early 2019. And when we started it, infectious disease was a core concern for us, even though we had at that point never heard of COVID. And it is ironic that when the coronavirus hit, we actually had to pause the project for pandemic-related reasons. And obviously now we're getting it back up in a completely changed context and sort of, in a sense, refocusing it on COVID. And so I'll be happy to tell you more about it in the Q&A. But for now, just let me offer this look at the COVID crisis through the lens of the sociological, what's been called the sociological mobilities paradigm, which basically means an analysis that's focused on the multiple and intersecting forms of movement that sustain and transform society and the economy. So when COVID hit last year, it quickly became apparent that in this pandemic, humans are the disease vectors, and that our 21st century patterns of global mobility really acted as this accelerant that enabled an alarmingly fast spread of this disease across continents and within societies. And so with that came this dramatic public health imperative, where we were told to stop moving, to stay put, to keep our distance. And so people talked about the world kind of coming to a standstill. But of course, as social scientists, we know that we have to tell a more nuanced story than that. So we wanted to explore which everyday forms of movement have been interrupted in the pandemic. Which new ones have been triggered, right? And what can we learn from such analysis? So our chapter draws some, theoretical inspirations from this mobilities work, which is very interdisciplinary work of people working within this paradigm. And, they talked about the fact that multiple intersecting movements of human and non-human actors are really a core facet of late modernity. And, I'm thinking here of thinkers such as John Urry, Mimi Scheller, Tim Creswell, others. And, the basic point about how globalization so far has been a story of accelerated mobilities of capital, objects, information, and humans. We all know this, right? That's well established. But what the mobility scholarship really shines a light on is that these mobilities are an unequally distributed resource, right? That for humans, mobility capabilities, right? So the extent to which we can exercise our agency through movement, right? To the extent to which we can choose where to go and how to get there, that all that is differentiated by class, by race, gender, nationality, disability, local conditions, and also the operation of global forces. And those things regulate sort of this phenomenon of who is able to move and who is trapped, as Hanam put it. And the capacity to move is also connected, very importantly, to whether we have the right to stay and dwell in place, right? So in that way, it's connected to citizenship. Ongoing movement without the possibility to safely stop and settle is unsustainable, right? And Mimi Scheller reminds us that mobility and immobility are always connected and relational, right? That they're not opposites, but they're dynamic constellations, and hence she uses this bracket, right? Immobilities, and that that one's mobility status really can't be taken for granted. And so, starting with these basic observations, then we went on to ask sort of what then continues to move in the who and what continues to move in the COVID lockdowns, and who and what has stopped, and what happens in between. And our empirical case was the one that was close at hand and that is the lockdown and the larger COVID policy in the UK, although we also looked beyond UK's borders. So we looked at the shifts in mobilities at the micro, meso, and macro levels, from the kind of movements of bodies in domestic and public spaces through the operation of state infrastructure and essential supply chains to international migration. And well, we didn't go as far as sort of other global flows, but we did look at international migration. And in the end, we argue that at each of these levels, COVID has exposed and exacerbated existing mobility inequalities, and that it also revealed the kind of the arbitrary, the transient nature of the regulations and infrastructure that's underpinning our societies and the global economy as we know it. And I want to show this through the prism of three phenomena. The first, it's going to be brief, but the first is going to be the figure of the essential worker. The second is going to be the system of medical supply chains. And the third is going to be the governance of international borders. So in the pandemic, some essential things, people and ideas still have to move, right? To save lives, to sustain life. But the majority of other things must not move to preserve public health. And so and this is this issue of this essential mobility, that most essential workers were workers who were structurally trapped in in poorly paid jobs with low job security and sort of intersecting class and racial inequalities. Of course, there were some prestige occupations among key workers, right? Doctors, workers in some essential infrastructure. But primarily, I'm talking here about delivery drivers, public transport workers, warehouse and factory employees, store employees, postal workers, right? So that sort of category of key workers. And they endured a really high risk of infection as a result of this essential mobility, right? They had a low capacity for self-isolation. And as a result, they often weren't able to self-isolate in this kind of prescribed way. And as a result, at least on the basis of data that's available through Public Health England, we can see that mortality rates in areas of deprivation where many such essential workers reside were double than those in more affluent areas. And by areas of deprivation, I mean primarily urban areas where migrant workers reside, often in shared housing, often next to more settled ethnic minority families that were also very heavily hit when it comes to mortality rates. And so this category of key worker or essential worker represents just one example of how this dominant discourse of mobility as something that's desirable and necessary in our global world, right? We all, being mobile is a good thing normally, right? That got scrambled and flipped on its head by the COVID lockdown. And mobility really became the source of trouble. Immobility was represented as a kind of this morally valorized social good. All travel, except the kind of strictly licensed movements of essential workers, all travel beyond that became suspect, subject to censure. Staying at home, though, was really attainable and manageable primarily for the middle classes, right? Who could work from home and enjoy sufficient space and get everything delivered to their doors, et cetera. So that was my first example, my first sort of phenomenon of interest. The second one looks at the mobilization of systems, complex systems in crisis. And of course, mobilization has the same etymology as mobility, right? It's about setting things in motion. So, so we're asking, how is a crisis response mobilized? So one observation we can make on the basis of the kind of mobilities literature on crisis is that the attention, and also just from empirical experience, we can say that in a crisis, the attention of authorities, of governments, really kind of tends to narrow, like it's like this kind of tunnel vision. There is this singular event, right, that seems to require like an emergency, right? It requires rapid decisions and action. But the irony is that these kinds of rapid decisions and like the decisiveness of governments is only possible and effective if behind the scenes, if the infrastructure continues to run smoothly. So Steve Graham calls it the infrastructural backstage. So for as long as it operates, right, governments can mobilize resources. But when that's disrupted, and this was the case in the pandemic, the crisis response itself falls apart. So under ordinary conditions, national health systems rely on medical supply chains, right, that distribute essential parts, equipment, medicines, chemical compounds. They do that in ways that can be largely taken for granted. We don't have to think about it. But in this pandemic, these logics or the logistics of these supply chains, they crashed. So it wasn't just the case of the UK, but health services worldwide, they couldn't effectively respond to COVID because there was a global shortage of personal protective equipment, respirators, chemicals for the tests that detect the virus. And so these problems really contributed to the staggering death toll in the UK in the first wave of the pandemic. And they were there were kind of underlying reasons, because this was made worse by 10 years of funding cuts that followed the financial crisis. And there was a pandemic preparedness infrastructure that, used to exist 10 years ago, but it was really kind of left severely crippled as a result of austerity. And so this went also hand in hand with the reliance on these lean kind of just-in-time supply chains for key medical supplies, such as personal protective equipment, right, which is made at kind of low cost in China most of the time, right? And those supply chains just completely collapsed after COVID exploded in Hubei, in the Hubei province in China. And so that then brings me back to this earlier point, right, about the arbitrary, again, and transient nature of this infrastructure that underpins global mobilities, and how its disruptions can have really deadly effects. And finally, I want to turn to the site that has become absolutely crucial in the national and global responses to the pandemic. And that site is, of course, the international border. So I already said that the COVID pandemic flipped the conventional discourse of mobility on its head. And another way it has done that is that we normally tend to think that emergency kind of produces the mobility of people, right? That migrants and refugees move, they get going because of some crisis, right? Some event triggers an exodus. So that's the kind of general imaginary of what causes particularly large flows of refugees. But COVID was different, right? It's a crisis that has immobilized people. Migrants and refugees were and remain around, but for a short time, actually, in April 2020, the movement pretty much stopped, right? And even after remained slower than before. So the UNHCR reported that at the peak of the first wave of the pandemic in last April, 168 countries fully or partially closed their borders, and 90 of those made no exceptions for people seeking asylum. So basically barred asylum seekers from their borders. And overall in 2020, new asylum applications dropped by a third compared to the same period in 2019. And I think the overall number of arrivals was like the lowest in, I think in 6 years or something. I would have to double check the exact data, but so to be blunt, the virus achieved what politicians on the right have wanted for years, really, a reduction in arrivals. And this in turn renewed interest in governing borders by means of public health protocols. So this is, of course, nothing new. We can go back to Foucault to trace the history of the biopolitical border and the role of health checks. And we can also, since I'm talking to an audience in Warsaw, we can, of course, also remember Jarosław Kaczyński, who in 2015 rallied law and justice voters by telling them that migrants bring dangerous disease, right? So I'm sure we all remember this. Well, COVID didn't come with destitute North African migrants on boats. It came instead on planes, following not the thing that Frontex calls illegal or irregular migration routes, but it came following perfectly legal and established global trade and tourist routes. So those travelers were then those travelers who really were central to the spread of COVID. They were repatriated by their national governments and they were enabled to quarantine at home. But the people who had no place to be repatriated to were targeted by the border regimes in the global north in the name of safety and protection, right? For their own good and for the sake of the protection of national citizens. And so there's this recent article that Martina Tazzioli wrote with Maurice Stierl, and they write there about how Italy and Malta turned away migrant boats in the spring of last year on the grounds that they were unable, the authorities were unable to provide a place of safety on their territory to any persons rescued at sea. So what then followed in Italy and Greece and also in the UK were the detention and confinement measures in barracks and hotels and on boats, on ferries, where social distancing was impossible and where the virus was rampant, and hence, of course, the infection rates were rampant as well. And so that brings me to my conclusion, and this is going to be my last slide. And so what I want to say in conclusion is that the advantage of focusing on these immobilities exposed by COVID is that it enables us to challenge pre-pandemic practices, right? Practices around care, safety, housing, access to healthcare, and broader logistics of globalization, right? We can see certain things that would have been taken for granted before. This is important because it helps build the evidence that our existing mobility systems really need a fundamental rethinking in light of the other overlapping crises that we're dealing with, right? I'm just going to mention two, the global crisis of displacement and the climate crisis, but you name your crisis. There are many crises we're dealing with, and many are related to our systems of mobility. And finally, the focus on movement enables us to articulate demands for mobility justice, which I think is essential to any notion of a fairer society. And I'm going to stop here. Thank you very much.
Thank you, Karolina.
Trying to figure out how to stop sharing my
Yes,
screen.
you managed.
Okay.
Thank you very much. Right now, I would like to ask Roxana Barbulescu to present her talk. And thank you.
Hi, hello, good afternoon. If you're joining us from other part, good and late afternoon. Thank you for the invitation to present today. I'm gonna talk a little bit about one of the projects that I'm working on, and I'm gonna refer predominantly to 2020. As 2021, it's a bit different, and I will explain in a second why that is so. It's a pleasure to be with you today, and I'm sorry not to be in Warsaw, but this pandemic is also an opportunity for other forms of collaboration, and also it's important sometimes to reflect on what we learn as well and the opportunities that it has created. And I'm going to talk a little bit about that in my presentation. I was very happy when I was invited to give this talk to present some of the findings of an ongoing project. It's a relatively new project that is funded by the European Economic and Social Research Council, and it is an initiative of the UK Research and Innovation Centre, the council that focuses predominantly on responses to COVID-19. So this is a special call created by the government to provide answers and solutions to the ongoing pandemic from the research community. So this in itself has been an interesting experience. And I wanted to take a second to introduce you to the members of the project, because this is a team project. And I'm very privileged to collaborate with Professor Carlos Silva from Compass University of Oxford, Bethany Robertson, who is based at Leeds, and Ms. Rosalind Cunningham. And having said so, I wanted to take the opportunity to introduce you to a little bit of the research behind understanding models of seasonal migration and what seasonal migration is. I come from a background when I look predominantly at migration within the EU, which is a very different and very peculiar, very geographically located type of mobility that has a political agenda in the back. It has its own history. It has a European community behind, different institutions that support it, protect the rights, and we have a certain history of it. Whereas when I started the project on seasonal migration, it was a different context, and I've discovered being a feature of developed nations all over the world, particularly in the northern, in the global north. And I wanted to look at what are the commonalities between the two and what it can learn one from another. Particularly for Britain, it was the case that in recent years, as I will show in a second, seasonal migration was not organized alongside the separate program that is with visa and immigration, but it had become a feature of intra-European mobility, with farmers and recruiters specialized in working in the farming sector and going directly in European member states and recruiting workers there. This has changed with Brexit, but there's been a transitional year last year that coincided with the pandemic, and I'm going to refer predominantly to the previous year in the presentation today. So when we talk about seasonal migration, often it is presented as the closest we have to a win-win migration scenario. But it does have more tensions when we think about, and it introduces more tension when we think about seasonal migration and the rights of migrants and migration opportunities. Why is it closest sometimes presented to as closest to win-win scenarios. And if you look around and just do a Google research, you will see the plethora of reports and think tanks among the research, among the policy community and policymaker communities, putting forward an argument for more circular migration, more seasonal migration, more temporary migration, as opposed to other forms. And there are some reasons why why some of the researchers go in this direction. And one is because there has been a demand, particularly for the receiving. So I'm going to divide the analysis in receiving states, so looking from the point of view of receiving states and that of migrant. For the receiving states, it provides them with a solution which is a quite effective and rapid, with immediate effect solution to workers having departed the agriculture sector for more attractive possibilities elsewhere in other sectors of economy, which are not as labor intensive and more rewarding, but also with other working rights, because agriculture is such a special area of economy across the world. There are exceptions, there are different ways wages are calculated, there are different rules around annual leave and holidays, for example, in peak season. There are a series of specificities of this sector in particular. They are also very attractive because they bring and they offer the option of having workers arriving just in time when the season starts and then departing at the end. And these are reliable workers because they come on the visa and they are usually linked or brought in by a sponsor linked to a specific site or a firm in particular. But at the same time, they also contribute to what farmers have developed as their business models, because they often live on share accommodation on site, so they are very close to where they do their work. And they also pay rent, and sometimes they offer further services. For example, there is a canteen on site and they can have their meals there. There are also incentives to accrue more savings if they work more. So they for migrant workers that then they can put into living the remainder of the year, the remaining months of the year. So that is more useful for migrants than others. And they have no or little rights to things like healthcare, including welfare, including accident insurance, family reunion, also no voting rights, and in most of the cases, no right to extend that particular type of visa. And important is to mention also that the rights of the seasonal workers end when they leave the country, when their visa ends. So they don't retain any right in the country where they have work after they leave the country. There's also an important aspect to mention here that because of this model of bringing migrant workers and of course keeping salaries low, it keeps also fresh produce at lower prices, and therefore it contributes to a healthier diet at more affordable prices, and it sustains the agriculture sector overall because it sustains the business model that has been developed to work with migrant workers. Some scholars before have discussed the so-called trade-off between rights and numbers of workers, and others have talked about partial citizenship that temporary migrants bring, which is a way of sustaining and not undermining the democratic character of policies. So these are predominantly the benefits of receiving countries in organizing seasonal migration. For migrants, the benefit is that it opens an immigration opportunity. Karolina was referring earlier to how states have increasingly organized and controlled migration. And it is particularly now more difficult for low-skilled migrants to legally access migration to another country in the developed global north. This is one of the few that you get visa types or legal opportunities, legal migratory opportunities that you can see spanning from the US, which has just announced a couple of weeks ago that they will increase the seasonal worker intake this year by 20,000. Even this in the middle of the economic crisis that the pandemic has created. So the loss of work that the pandemic has created. So there is that aspect that is important, and I think that it brings migrants an experience abroad and to experience other cultures. And I think that it's really important to discuss this aspect of life choices and personal development for low-skilled migrants, even in the sector of agriculture, and not keep it to high-skilled migrants that are more educated in narrating their migratory choices than low-skilled migrants. And it does have that when you discuss when you do interviews with the migrants, they do talk about all the different things they've been seeing, what they've learned, the trips they've been managed to do, not in the context of pandemic, but they do take advantage of this experience abroad. And of course, it's the very real aspect of increasing savings and accruing some funds that they can in turn invest in personal development and household. And there is already now established knowledge and research on the fact that it has a positive impact on the person in terms of there is increased healthcare spending after such stays as seasonal workers, and increased return on investment on the education of their children. So there is the second generation that benefits from this migration. In terms of cost, there is by now mounting evidence of exploitative situations. And this is from the point of view of labor, but also that many times the most vulnerable migrants are caught in these programs. There is a high risk of modern slavery and trafficking, and overstaying the visa and becoming undocumented as a consequence. There's also the question of children and left behind family and the impact that has on the trajectory of the family. And less spoke about, but the literature is quite, there's a mounting evidence on that, primarily because it rests this part of research within health studies, is that it brings increased health risk for the migrant for the migrant worker, particularly because of the exposure to pesticides, back problems, and accidents from operating heavy machinery. But with the pandemic, it added that extra layer because they've taken more risk by moving and crossing borders amidst the pandemic, and they've done so in the beginning of the pandemic, as the agriculture year always starts around March time, March, April, May, when we knew very little and almost the entire Europe was in lockdown, but we knew very little about transmission. There was very little protective equipment, and they were taking the risk and transiting at that particular time. I just wanted to briefly introduce you to the pandemic in the UK, which again is a very specific case, which is one of the countries that until recently fared worst in terms of it was most hit by the pandemic. We know that on the 11th of March on 2020, the WHO declared the outbreak a pandemic, a global pandemic, and the UK government took a couple of weeks to declare their first lockdown. Although, and this I can draw on the research that I was doing at that time for the other project that was in field work. at that time. And the migrants then were telling us that already, and the participants, that already many of the companies have switched to working from home a week earlier than the announced national lockdown. The decision was introduced only on the 23rd, and since then the UK has had 3 national lockdowns, with significant, and for the period where they weren't national lockdowns, there were significant regional lockdowns apart from normal restrictions. Many people lost their lives, over 100,000. In the end of January, we reached 100,000 people who lost their lives. To date, there were 4,400,000 people that had COVID and that tested positive. And the most recent, and that has an impact has an implication for seasonal migrants, is the vaccination rollout, which started the earliest in the UK on the 8th of December, the first vaccine. And current coverage rates are at 70% almost for 1 dose and 35% for 2. What happened with the seasonal workers? And I will ask here Marta to remind me of time, because the time disappeared.
You still have 5 to 10 minutes, no worries, yes.
Perfect, thank you so much. Yes, this is the challenge with webinars. Yeah, I miss that friendly face from the chair indicating time. The UK in particular has been historically highly dependent on seasonal workers to work in agriculture. It has had a sectorial-based scheme since the 40s, which it discontinued in 2013. And the reason for that was that in the last years, it only worked with strategic partnerships and recruited essentially in the next accession country. So if Poland and Lithuania and the A8 countries were set to join the EU in 2004, they were recruiting from these countries before 2004. And then they recruited exclusively from Romania and Bulgaria until 2013. And when in 2013, the accession restrictions were coming to an end, they discontinued the program altogether, because essentially the farmers and recruiters were working directly and employing people directly in the source countries. There was full freedom of movement. There was no need for a specially devised scheme. In turn, in this time, it has created a very high dependency that there are no exact data, and this is an important aspect for us. We're looking carefully at this in what is the size of seasonal workers, how big is the demand for seasonal workers, but estimates from industry, from the organization representing farmers, sets it at 75,000. The State Department for Environment, Food and Agriculture and Rural Affairs sets it at 50,000. But the high regardless of the volume, the estimates are there is a high dependency on migrant workers. And in 2018, so 5 years after the scheme was discontinued, the special scheme was discontinued, 98% were EU citizens. Of the workers in the field were EU citizens. So what happened with the pandemic? March arrives, 23rd, the lockdown comes, and this is precisely the time the farmers were recruiting and organizing the trips for workers. There's been a few points that were extremely important and have changed substantively the way seasonal work is being organized, and it runs even in this year and will run for the coming future. One is that with the pandemic, the seasonal workers, as Karolina was saying, were put into this category of essential workers. They weren't defined as such. They were grouped together with the agri-food workers more generally, those producing food and working in the food industry much more broadly, including restaurants, but they were part of that category. Then they were especially exempted, and here they were named in the guidance. They were exempted from international restrictions that applied to traveling from abroad, and they were also exempted from isolation in the beginning, in the sense that they would still be carried, and there was an organization of how to bring from the airport to the farm, but they would do the isolation on the farm from the beginning. So there wasn't that isolation that applied to other workers. And I mentioned before that of course, Britain has left the EU already in 2020, but there was this transitional year last year. And as a way of replacing and understanding that the freedom of movement will come to an end, the UK introduced a pilot to try to, as a testing case for reintroducing some form of sectorial visa scheme for seasonal workers, replacing that was discontinued in 2013, if you remember. In the beginning, it was just a very small trial visa system that had 2,500 places on it, which was then expanded quickly because of also because of the pandemic to 10,000. So last year, the way it worked is some farmers still recruited directly in the EU, whereas others used the visa system and piloted these 10,000 visas that were made available. And there were many issues around this, particularly as also Karolina mentioned, some immigration offices closed, the consulates were not operating as normal. So there were delays in processing the visa applications for this program, and it was only the year 2 in which such a program was being rolled out. So it was also a testing situation for many. In addition, the government also introduced, together with industry, a campaign called Pick for Britain that was championed by Prince Charles to incentivize the recruitment of local workers. Local workers that could be around in the local community, but could also be drafted from further afield. And it was a site that matched effectively workers with those who had wanted workers, with the farmers. And I put here a picture from one of the news items that covered an event that took place in April. So just in the first 2 weeks in the third week in which we were all witnessing the pandemic and learning to live it from lockdown, changing our habits to working from home, and stopping of travel, stopping of restaurants. The farmers organized to bring the workers through chartered flights, particularly the bigger farmers, and they brought in the farmers themselves. There was that cooperation needed from the government, and it was quick to respond in introducing this exemption for farmers. And in some cases, there were also negotiations with the countries of origin, because some had also in place a ban on leaving the country, just to try to contain and minimize the time that people spent, the country spent in lockdown. But there were made exemptions even in countries of origin. I think that this is important, not only in countries of destination, but also at origin, there were made exemptions. And we can see the contrast was very apparent at particularly that point in time. Because we didn't have that much understanding about airborne transmission, sharing a flight with many more. And indeed, there were cases, particularly in June, there was a large outbreak at one of the farms, and contagion happened during the flight. And they then tracked They were, it arrived on arrival, the outbreak started, and then some, because the workers were being sent to different farms across the country, there also were the contact and trace volunteers had to also get in contact and put into isolations those that were sent further afield. So some remained in England, and whereas others from the same flight were sent to Scotland. And this was really surprising at that time. And I mentioned before the pilot, that it was was in its second year last year in 2020. And I mentioned that 10,000 visas were made available for farmers to use last year. They were used up to 72%. So some part of them were not used, although there was a large demand. Farmers were making the case that they absolutely need it. They don't have enough workers, and hence the Pick for Britain. But Pick for Britain didn't deliver to the initial expectation. It had an important value, symbolic value, and raising awareness value. And it did brought to the attention of more the necessity and the sustainability of the farming sector and the need for workers in this sector. But it didn't have responded to the demand. Let's put it this way. So it's from the 10,000 visas, 7,200 were taken and people arrived. There was an array of countries that people recruited from. You can clearly see that if before farmers used to have workers from the EU countries, it completely shifted with Brexit, and particularly the visa, also because those from the EU would not need the visa still last year. They completely shifted, and recruitment focused exclusively on non-EU countries, but the large majority here is Ukraine, that accounts for almost 90% of the workers. Across the board, there are only 15 countries of origin, not that many, the majority in the eastern neighborhood of the EU, but also a few of more traditional countries of emigration. Like the Philippines, and I've seen now some news. There's also now conversation to recruit from Morocco. That is also one of the main countries of origin for the southern European states for seasonal workers. And just to bring, for the sake of comparison and show the evolution, this is what happened in 2019, sorry about the year, 2019, so the previous year, when they were made available again, only 2,500 visas, and they were only recruiting from five countries. It was a very small number comparatively, and the structure was similar. So moving forward in the year of the pandemic, they kept a similar structure of recruitment, but with much more participating countries, which is quite counterfactual, or counterintuitive. You would have expected to see more concentration where they have more relationships. No, the negotiation went forward and the number of countries expanded, while also the numbers of workers expanded. But there was this delay. Not all visas were used. Just by comparison, I wanted to bring the wider picture of what has happened in terms of substitution, and why is it more interesting to look at seasonal migration now. So if before workers were being recruited through freedom of movement, it only happened for a number of 6 years, but it did establish the complete dominance or dependency of the system in only 6 years. So under the freedom of movement right, the farmers would, or the employer would have, because sometimes the employer is the recruiter, the recruiting agency, they are not, the farmer is not the official employer. There was that possibility of direct recruitment. They had access to some welfare benefits, not all, access to healthcare, family reunion rights, and the ability to change the employer sector of employment. They had the ability to return to the same farm every season, also to promote within the same farm. And they were in place because they were part of the same political and economic union. They were a coordination between labor authorities, because these recruitment agencies had to be also at that point in time certified and licensed to contract workers in the agriculture sector. With seasonal workers pilots, so the visa system that comes to replace freedom of movement, but also meet the demand for seasonal workers. So now for 2021, this will be predominantly left on the pilot and on the visa system to bring the workers to supply this workforce. The recruitment is managed by the licensed agencies. There is no recourse to public recourses. So to welfare, there's very limited access to healthcare, and it has an implication here on vaccination, although vaccination has been confirmed, but the seasonal workers are not in the database, in the national database of patients. So they can register themselves, but they will not be called upon to go for vaccination. There are no family reunification rights, no ability to change the employer because the visa is linked to the sponsor. The person, the migrant could reapply, but this is not written in it, not designed in the policy as it stands. And there is a limited existing coordination between the labor authorities in sending countries and in the UK. Whereas prior to that, that was not the case. And there are implications for that. And this brings me to the conclusion that we've seen with the pandemic, we've seen in terms, because to refer to the title and the theme of today's webinar, we've seen a territorialization of the national citizens since the start of the pandemic. But we've seen a ring fencing around the mobility of seasonal migrant workers. And in ring fencing this mobility, there's been a cooperation between state actors and private companies and sending countries. And this was done to keep this development was driven predominantly by the development nations that are dependent on the migrant workers in the farming sector, and the necessity to keep these essential sectors going through the pandemic, particularly the agri-food sector, and to feed the population during the various lockdowns and the pandemic. Thank you very much. And if anyone wants to has question or wants to also engage outside of the webinar, I welcome comments and messages and ideas. Thank you.
Thank you very much, Roxana. We already have some comments and questions on the chat. I will read out the first comment from Jan Grzymski. He writes, I think what is very interesting in pandemic emergency immobility are the long-term consequences of linking the right, privilege to be mobile with the biological knowledge of people. This is biopolitics in full swing, of course. It will for sure create new political lines of divisions and new inequalities, in particular with the rapid introduction of COVID passports. But this may also mean that in the future, more advanced biological knowledge of people than just information, vaccine, not vaccine, will be determined who can be mobile or not. And I will maybe ask also Karolina Łukasiewicz right now to ask her question or comment in person, please. Karolina?
Yes, I'm here.
Yes.
I'm sorry about that. So first of all, thank you for a very interesting presentation. And I have a question to Karolina, to the first presentation. I found the concept of essential workers very interesting, and I was wondering how it played out in the context of policies developed in the UK, such as the eligibility for vaccines, for example, because if I understand correctly, in the UK, the age groups were predominantly like defining the order of vaccines, whereas in other countries, for example, in the US, the essentiality was a criteria, so essential workers were eligible to vaccinate very early, but for very early on, but especially among undocumented immigrants who were often essential workers, there was a lot of mistrust to the healthcare system and the government in general, so it didn't really help. And then I'm also curious, what were other policies developed for or available for essential workers or migrant essential workers in the context of COVID? Because then again, I'm thinking about different examples of policies developed in the US, which there were many of them, for example, because of overcrowding that migrant experienced cities would offer staying in hotels to quarantine or so on, but it didn't help because of the marginalized position and the precarious jobs that people would have to take anyway and go to them anyway. So then the offering space wasn't really helpful. And so that's my question. Thank you.
Karolina and Roxana, if this is all right with you, I would ask also another question that is written in the chat, because it, well, I would say adds to that, what just Karolina Łukasiewicz said. And this is from Agnieszka Radziwinowiczówna. The question is for Roxana Barbulescu. What is the EUSS enrollment among the agricultural workers, and what, in your opinion, will be the participation of EU citizens in the seasonal workers agricultural scheme, provided it will be now resumed? There's a comment as well from her to the conceptualization of the seasonal migration and its benefits. I would add that this is a safe migration that would otherwise could be undocumented. It also enables leading transnational life for those who wish. And a short question to Karolina Follis: is the international mobility of people now back on its feet, as those who travel now are middle class, given the need to self-isolate and test after return to UK? So I think for that moment, maybe I'll let you reply and respond.
Right. Am I still on mute? Unmute.
No, we can hear you.
Okay, good. Right. Yeah, so before I respond to the questions, just wanted to say thank you to Roxana, because it was a really enlightening presentation, and you know, a lot of things that you've answered, a lot of things that I was wondering about the seasonal agricultural workers. So yeah, so going back to, like, starting with the first comment, was that from Jan? I think that's exactly right. What you're saying, and the kind of I don't want to say return of biopolitics. I don't know, the return with a vengeance, because biopolitics has never gone away, but it is it has certainly coming again to the forefront. The way I've been sort of making sense of this is that you know, there has been this constellations of concerns governing the policing of borders over the course of the past 2 decades, that involved the economy, right, and security, security particularly in the post 9/11 era, with matters relating to the fear of terrorism, but also just overall notions of kind of infiltration by dangerous, illicit migrants, bogus asylum seekers, and things like that. And so it sort of states very much fixated on this notion of preventing the abuse of the asylum systems and things like that. And with that, health for these past 20 years has been a little bit in the background, although we have, it existed in the admission policies and immigration policies of many states, right? For example, the United States, for any immigration, for a kind of whether that's a green card or citizenships, right, that there's a need to, for instance, perform HIV tests, and there are restrictions in various other jurisdictions, right, if people are carriers of particular infectious disease. But I mentioned Kaczynski in my talk, but of course Kaczynski was not the only one who would be talking about migrant spreading disease. That was also a kind of rallying cry of the Italian far right, where Salvini's people would also kind of spread this notion, this idea that that migrants are a threat to public health before COVID. But that has now kind of hit with an unprecedented force. And I think, and it's not just me and people who work, who research this, some of them, have already seen more evidence of this, is that that this fixation on the body and on the pathogens that it carries might be really coming to the forefront again. And so then that forces us to ask the question about the forms of surveillance that are going to be deployed in order to monitor that. And you say that, the right now, all the attention seems to be on vaccination status. A lot of attention, and that comes out in some of the other questions, is on COVID status, so being tested. But I think compared to what we are likely to see in the future, those are very primitive ways of distinguishing, who is going to be eligible for movement and who's not going to be eligible for movement. And I think that, as time goes by, both the testing technologies and the specific ways in which they're going to be kind of networked and accessed by governments is going to just become a lot more sophisticated. So I would think that this is definitely, a space to watch, and then to follow how that then further exacerbates and perhaps creates new mobility inequalities. So thank you very much for this comment and question. I think the next question that I wanted to tackle was from Karolina, where you asked about essential workers. Is that right? And you asked about eligibility for vaccines. I'm glad I wrote it down, and sort of other policies that kind of responded to the particular challenges that essential workers faced in the pandemic. And so I can answer that by saying that when it comes to, as you said correctly, in the UK, when it comes to eligibility for vaccines, it was primarily organized through age groups, with the oldest seniors coming first. I think it started with over 80s, and then kind of going down the age groups. I think we're around we're around the 30s now. But it did, initially it really was just seniors, with one exception when it comes to essential workers. Healthcare and social care workers were eligible. I think in the next group that came, I can't tell you off the top of my head what the different groups were called, but the next group that came after the very oldest seniors was a group that included people with certain underlying conditions and healthcare workers and care workers. I don't know, Roxana might remember better whether when could doctors and hospital workers get vaccinated very close to the beginning of the program, but not, I don't think, immediately. Even that, the interesting thing I can say about this from experience, because I volunteered at a vaccination center, is that this interpretation of who's the care worker initially was really quite loose. And so initially, that was like around early February, people would come to the vaccination center, bringing somebody, an older person or a person with a disability. And their job that they brought this person was that they drove them there, and then they were pushing the wheelchair in the vaccination center, and that made them a carer, right? And in that capacity, they'd be offered the vaccine right then and there. And I was chatting about that to one of the firefighters who's administering the center, and I was like, oh, isn't there rules around this? And he was like, well, we have some discretion because they will be vaccinated anyway sooner or later. So, but then those kinds of stories, I guess, leaked to the media. I probably shouldn't be even telling you this, because then the volunteers were told, don't talk to anybody about this. And this was made much more strict. So then at some point, people had to show evidence that they were in fact care workers employed by, say, a care home or a care facility of some sort. So that's as for other groups of essential workers, they were not in any way privileged in accessing the vaccinations first. It was a contentious issue, particularly around the teachers in primary schools and primary schools and secondary schools. Most actually secondary schools had kind of higher infection rates than primary schools. But the kind of government's response to that was that, on the whole, looking at the age averages of teachers, they are still, like relatively young, and therefore as a group, and therefore not so much at risk at COVID statistically. And therefore they will just wait their turn according to that age classification. As for other policies, you mentioned hotel accommodation. That was done not so much for migrant workers as it was done more for asylum seekers ostensibly to improve their conditions and enable social distancing. But I mean, there was a terrible case in Glasgow when then subsequently, people died in one of these accommodation hotels because it was organized very badly, and kind of people were abruptly pulled from where they lived and told to pack all their belongings and go to a hotel. They didn't know what was going on. It was not a very well executed approach. I don't know so much. I think might be really interesting to hear what Roxana has to say about this, because the other, then this is the final thing I want to say in response to this question, is the kind of the adaptation of the workplaces to make them ostensibly COVID secure. And so in order to be able to bring your employees into the workplace, the employers were made responsible for making their workplaces COVID secure. And that could mean a lot of different things, such as, providing disinfectant spray and wipes to wipe surfaces and hanging screens to separate people. But, as some commentators said with a bit of derision, that really in many cases amounted to a hygiene theater and just a performance of being COVID secure rather than actually protecting the workers. So that's what I can say to you on this matter. I should probably pass over to Roxana to answer the question.
Yes, because we have many more questions
Yes.
and comments, so you will speak in a moment soon for sure as well.
Thank you, Karolina, for that, and thank you to the other Karolina for the question, and to Agnieszka. I think there are many issues here that we could talk about this for 2-3 days, and just to pick up on and to address the question, I mean, there was an interaction in what was done for migrants and for migrant communities. It was an interaction between the healthcare system and how the coverage of that, the access to that, and how the vaccination was rolled out. There was also a question around who covers the cost of the test in many situations, and how quickly they introduced this quick test. They've been introduced for on farms in the UK, so just as to quickly identify outbreaks at an earlier stage and prevent larger outbreaks, so to isolate. But I mean, there is a question that if the essential workers were working, they were working under very difficult conditions, not only taking risks, but their mobility, their how they organize their work was limited. Seasonal workers could not had very limited, much more limited mobility outside of the farms because of that, because people were afraid that there were these large groups of people entering their small rural communities. You have 400 people arriving on a campsite. It's in the middle of a pandemic that raises some concerns with the local community. But indeed, we have to also look, I think it's really important. I'm based in sociology, and I'm really always interested in the stratification of rights and how class affects the phenomenon that we're observing. And for seasonal workers, there are many questions here to be asked, and then they have to do with migration system on one hand, and with the food and the food system that we want to have, and questions around as well more climate change and net zero emissions. If it is better to bring people here to do the work for preparing this food, and it's quite limited what you can grow in UK. And eventually we eat more banana than strawberries, but we grow only strawberries. So there is also a question of who benefits of the work that they produce. But there are many questions that have to be opened up here. And certainly whether ultimately there is a question of how can we improve the situation, because there are tweaks that could be, there are countries that are doing it better, and there are different roles that seasonal migration takes in different places. So for example, New Zealand, which is really interesting, the tiny nation, and it's quite a vast territory, but they bring seasonal workers from the Pacific Islands, and in some cases up to 20% of the entire population of a Pacific island will come to New Zealand to do agricultural work in seasonal agriculture, and that is completely a development program in itself. It's no longer just a migration opportunity. It's a mobility system that is being developed, and there are different ways of doing it. Do we want to do it by bilateral agreements? There is an increased interest, and the EU has been a champion and quite favored this possibility of migration partnerships, but there is very little alignment with international conventions around these mobility partnerships. We want to do it like this. Others say in any situation they will have the seasonal workers, in particular because agriculture is also so specific and you have many exceptions and very little unionization. You will also end up to have very vulnerable workers attractive in this sector. So should we abolish it completely? Who will do the work, and who will prepare food? Who will grow food for a growing nation, and then healthy food? There are many questions around migration. What I like particularly in this project is that it looks into migration and what it feeds elsewhere in things that impact us on a daily life. And the big questions like climate change. Is it better to have workers coming in and doing this work and growing food here, or we should import it, or we should bring the robots to do it, or should we increase the prices and therefore pay more for food, for fruit and vegetables, for fresh food and vegetables, or should we have fresh fruit and vegetables at the end? So there are many questions around this, and just briefly to discuss what Agnieszka, to address Agnieszka's question, I think the USS is there. Many farmers were well advised by their representative organizations, and they advise workers to apply for pre-settled, and many have pre-settled. So potentially we're looking now even at dual system. Workers with pre-settled that have many more rights and they can come and go for 5 years, and people that come on the visa, and then they potentially could be on the same farm, doing very similar work, but with very different conditions than others. So you'd have stratification within the farm as well. You could have people on visa that are very strict, and rigid system is the most rigid visa because it's only for 6 months. You have people with pre-settled that come and go to the EU potentially for 5 years, and this is what they do. And you could have local workers, which also tend to be migrants on many occasions. So the local workers, there are also many migrant local workers arriving from nearby cities rather than British workers from the local communities. And they are another group as well.
Thank you so much, Roxana. Now, Asaf Augusto wanted to, yes, you need to unmute your mic. Thank you.
Oh, can you hear me? Oh, thank you so much for this wonderful presentation. Can you hear me?
Yes,
Oh, thank you.
Of course.
Yeah. I don't know if it's a question or a statement, but in one case, you have these policies being enacted sort of to help the migrants to stay the essential worker. But on the other hand, you have the rise of immobilities, especially of migrants of Asia descendant, particularly Chinese, so to say, where you have cases of rise of violence in USA, where migrants actually fear, or Chinese descendant fear of not going out on their own because they fear for their lives. So in your project, I know that you work more in the UK. Have you come across cases of violence against migrants of Chinese descent? Or, yeah, because there is an element of immobility within this, these, so to say, attacks as well. So where people fear for their lives of going out, even though they're already part of the society. So that's my question.
Thank you very much. If that is okay with Karolina and Roxana, I will also just read the questions on the chat now from Dominika Pszczółkowska to Roxana Barbulescu. Can you clarify how many seasonal workers there were in 2020 or 2021 by nationality, irrespective of the legal route they came through? And were there any Ukrainian seasonal workers before 2020 coming illegally or through other channels? After, maybe I'll let you reply to both questions, and then Kamila Fiałkowska, if you can please ask your question after that. Thank you.
Very quick answer to the first question: no, nobody knows, because we have a very clear idea of the visa, and this is one way of, there is surveillance in when you extend an immigration route, you also introduce a surveillance system, an accreditation system. The migrant applies, so you can keep track in a different way. Those who had pre-settled or they were recruited freely, no, it's very difficult to track those. There's not centralized or administrative data on them that we could have, and this is important. There are all different ways to estimate it, but overall there is no consensus of where that number stands. On the second, of course, there were Ukrainians before in the 40s. So in the early post-war period, there was some coming. We can take more questions.
And in regard to violence towards Asian migrants, I understand that that was not present in any of the projects. Yes, that did not come up.
I mean, there was some reports in the press, there were, but we've seen it also on campus, particularly from students that were speaking more. But there were racism against the Asian students as well before the pandemic. So there was an increase. The numbers indicate that, but there was before as well.
I'm not sure if Karolina Follis wants to reply to some extent. If not, then Camila.
I don't have a lot to say on.
Okay.
I mean on this issue, but I'll say the same thing that Roxana said, that we have seen a rise of aggression towards particularly Chinese students, just at this kind of very cusp before the campus lockdown, but when people already knew that, you know, that the idea that the virus came from China, and there were some very unpleasant situations related to that. But it's not something that I have captured in research as such.
Thank you. Kamila Fiołkowska.
Thank you very much, and thank you for this presentation. Roxana already knows that I'm very interested in her project, and we already talked about it. But I have a question that is somehow related to also my work, because I cannot escape comparisons between farm workers in the UK and farm workers in Germany, which was in my focus some time ago. And I wonder whether you observed how the situation of the intra-EU farm workers in Britain was looking like if you compare it with the people from outside the EU. What I mean here is that, for instance, in my work and my colleague, we observed that there is these differences, and paradoxically, the intra-EU workers, for instance, those who were working in Germany, like Polish workers in Germany, were not exactly better equipped to protect their rights if I would compare them to outside the EU workers. So like when I look at the Ukrainians in Poland and Poles in Germany, we found out actually that the Ukrainians had, you know, better scope for action, wider scope for action. They could change the employer. While, for instance, the Polish worker, the EU workers in Germany, for a lot of years, they didn't have this chance, these opportunities, for instance, to change the employer, because they were by the law limited to work in the agriculture. So there were also these transitional periods arrangements. They are not in place anymore, but they played a role. So they kind of differentiate the position of the EU farm workers and outside of the EU farm workers, which is also related to the country and the migration regime in the country, right? So Poland has a different one. Now the UK is transitioning. So I wonder how this unveiled in your case, whether you observed already some instances of this differentiation. I also have the question about the essential worker, because I don't know if in the UK, are the farm workers included under the label of essential workers? Because this is very problematic. It is, yeah? Okay, this is very interesting, because in my opinion, it's like essential hands for work, but not essential workers. They are still deprived of so many rights that the essential workers should be given. That's another common question. And something to follow up on what Agnieszka mentioned in her comment. When we look at the intra-EU mobility, well, and also having in mind your table with the healthcare, with the all those kind of things that were afforded to the intra-EU farm workers, I think it is not always, we cannot take it for granted, in the sense that when we look deep down, there's a huge areas of informality, of paralegal activities, and so just, you know, mentioning that, okay, these are the EU farm workers, therefore there are no problems such as illegality or access to healthcare is as problemless. Well, I think it's more complicated, and I also wonder how it now will look like in the case of Britain, especially in this transitional period, and how it will continue to develop in the coming months. So I'm very curious in your observations from the last year, and also what you expect to find out.
Roxana, if you allow me, I would just read out also the question from Deni Pencheva, because this is also to you. Thank you for your fantastic presentation. Has there been any policy clarity regarding post-Brexit seasonal mobility apart from the year extension of the seasonal agricultural worker scheme? This type of mobility is not covered by the new points-based system.
Yeah, thank you to Dani for the question. And to Camila, hi Camila. I think that there's a lot to tackle here, and there will be papers coming, so there will be more material coming in this direction, and we're doing more observations as well and gathering more data, because this is already 2021 pandemic is very different from 2020 pandemic, and whilst we know that some measures will remain in place, it looks and it feels very different, and the farms have transformed. So the places and how migration is organized and mobility across the border has completely transformed, thinking last year in March or April when people were arriving. So now there is test on farms, there are exemption in place. It's not informality that there is this thing that you can go there. There is guidance in advance. So the mobilities have been reorganized because of that, and the workplaces have been reorganized. Pertaining to a question around essential workers. On the differences on farms, there is a bit of that. I think we need to understand how much that is the case, in the sense how much do they coincide on the same farm. I think it looks as if they specialize, so the employers specialize in whom they contract, because they work with particular recruitment agencies, but they can be a bit of standing in the same workplace. I think that you're right. There is a question: is we cannot jump to the conclusion assuming that if in law they have more rights, that's also the case in practice. And also for 2021, even EU citizens, if they arrive in 2021, so even on 1st of January, they no longer have any of the rights that people arriving before that date would have. So essentially they are in the same conditions as non-EU, and therefore will need to apply for the visa if they want to come and do agriculture work. There is more work to be done on this, and I'm glad that you're continuing your work on this area, Camila. So then there has not been a set policy, approved policy for 2022. Only what we know exactly, it's an extension of what happened last year and an extension of what happened in 2019. So we are on year 3 of the pilot scheme. And this is under discussion. There is guidance from the Migration Advisory Committee that made some recommendations in the 2018 paper. And there is more assessment of how these pilots work, and there will be a new policy, but there's nothing that has been announced as it cannot be too far away from what we have with the current pilot. And considering that I didn't announce, but for 2021, so for the current year, the pilot that last year was 10,000 places is 30,000 places. So it's quite a big pilot if you're talking about a pilot, to have 30,000 visas in a pilot. Yeah, does this answer your questions?
Thank you very much, Roxana. There is also a question from Jonathan Jarrett regarding new seasonal workers. The fact that visas are tied to their sponsor. Is this not indentured labor? What keeps it clear of definitions of modern slavery, the theoretical right to abandon the job and leave the country?
Yes, this is a good question, and there is evidence of that. There is evidence that there are some cases also trafficked people. There's evidence of some cases or very close to what would fit to the ILO definition of modern slavery. But we also have to put this a bit into perspective. So how does the immigration system work? It does work with the sponsorship certificate. So, you know, even family reunion works with the sponsorship certificate. So even if you go for study, you go to study to a specific university. So it is the way that it made it, particularly in Britain, it is the way that it has been set up. The immigration system to link you to be driven by the employer that is issued with the certificate, and based on that you get the visa. And it's the same with the healthcare, with NHS. So it tends to be linked with the employer. The question is after how long or in which conditions you can leave the employer or change the site. And this is also a kind of revolution that is going inside with seasonal migration projects. In some countries allow it, yes, others don't. I know the last country that changed legislation to allow to change the employer was Finland, that also didn't have it. So it was a permanent, it's a quite common feature of immigration system to begin with. For the first visa, for the temporary visas, it tends to be this way. And the second is that it tends to be also a feature of seasonal migration, but this is changing. In the UK still that is not the case, but we see evidence in other countries changing. So it's also a question of governance and global governance of migration. How far good best practices can travel and how far can countries learn from one another. Establishing higher standards in this area would be really useful and kind of make these projects and these schemes more decent for the people that use them.
Thank you very much. Well, unfortunately, we have to slowly finish our webinar. A big thank you to all of the participants for very interesting questions and comments. And of course, a big thank you to our both guest speakers today, to Karolina Follis and to Roxana Barbulescu. And I hope we will see each other at another seminar soon to listen more about the results of your projects.
Thank you, Karolina. It was a pleasure to share the floor.
Thank you. Likewise, Roxana, and thank you everyone for coming and for your stimulating questions. And I just want to make one comment about the question from a historian, that it's really great sometimes to be asked a question outside the discipline, because it really allows us to denaturalize some of the things that we take for granted. So thank you for that. And again, thank you for your attention today.